My name is Grisel Santiago Rivera, and I am the Interim Executive Director at End Domestic Abuse Wisconsin. Releasing our annual Wisconsin Domestic Violence Homicide Report is a sobering reminder of how often domestic violence results in a tragic outcome. Our intention with producing this report each year is twofold: to honor the lives of the victims of domestic violence homicide in Wisconsin, and to catalyze improvements in systemic and community responses to domestic violence. In 2019, there were 72 lives lost in Wisconsin due to domestic violence. This figure includes 52 homicide victims, 18 perpetrator suicides after they committed a homicide, and 2 perpetrators killed by responding law enforcement. This edition of our homicide report includes a section that analyzes data elements from our 20 years of collecting domestic violence homicide information at End Domestic Abuse Wisconsin. The review of our 20 years of data indicate that in at least 57% of the homicide incidents, prior domestic violence was a precipitating factor. Additionally, from 2000 to 2019, a victim leaving an intimate partner relationship preceded at least 42% of the cases we identified. These percentages underscore that we still have work to do in Wisconsin communities to support people who are currently experiencing domestic violence by directing them to individualized crisis intervention and support before the abuse escalates. Furthermore, victims of domestic violence should be made aware of the risk involved in the decision to leave an abusive relationship and have access to all relevant resources, support, and services needed to ensure they have a personalized safety net at that critical point in time.
Hi, I'm Sarah Kroll, the Homicide Prevention Program Director at End Domestic Abuse Wisconsin. For the past several years, End Abuse has received funding from the Wisconsin Department of Justice to provide training, support, and assistance to Wisconsin communities with the goal of preventing and reducing domestic violence homicides. Part of this work is through implementation of the Lethality Assessment Program Maryland Model, or the LAP. To date, 175 law enforcement agencies in Wisconsin have received training on implementing this program, which involves officers utilizing an 11-item research-based questionnaire to gauge the level of danger in intimate partner violence cases. When officers assess a victim to be in high danger, they utilize a referral protocol to connect victims to domestic violence programs immediately before leaving the scene. The process also helps victims know what to look for if things begin to escalate. Beyond supporting LAP implementation, End Abuse promotes the development of high-risk teams in Wisconsin, which is the only other nationally recognized evidence-based homicide prevention strategy, aside from the LAP. High-risk teams complement what's currently being done in communities that are implementing the LAP by creating a wraparound response to the most dangerous cases, promoting victim safety and perpetrator accountability as the case moves through the criminal justice system. The LAP has not been implemented statewide, nor has it been used for long enough to notice a measurable difference in our state's homicide numbers. In fact, our 2019 report tragically includes 25 more deaths than our 2018 report. This begs the question, what else can we be doing, and where are there additional disconnects that are not being addressed? A perpetual barrier and challenge we know survivors face is the difficulty of achieving long-term economic stability, an aspect of which includes access to safe, affordable housing. End Abuse is excited to announce we'll be expanding homicide prevention work to include developing and enhancing relationships between domestic violence programs and housing and homelessness service providers in partnership with the Balance of State Continuum of Care.
Recent high-profile killings of Black people at the hands of law enforcement across the nation have caused us to further consider whether our homicide prevention work, as it looks currently, aligns with End Abuse's desire to dismantle systems of white supremacy. We believe current systems create racial inequities and perpetuate systemic racism, especially within the criminal justice system. All forms of violence and oppression are interconnected. And at the intersection of domestic violence and racial inequities, the criminal justice system often also fails victims and survivors of domestic violence. These tragic events have underscored how our homicide prevention efforts, primarily focused on law enforcement response, may further propagate the systemic violence we aim to end. Our intention is not to abandon the lab, as we know it is effective in decreasing lethality for the many survivors in high danger who decide they must call law enforcement.
Moving forward, we hope to broaden the list of community partners we equip to implement homicide prevention programming similar to the LAP in conjunction with local community-based domestic violence programs. Widening the range of service providers who are both knowledgeable about lethality risk factors and who have established relationships with domestic violence advocates will improve survivor access to individualized crisis intervention and long-term support. For too long, domestic violence has lurked in the shadows and is something many still consider a personal problem. This is simply untrue. We all live in an environment in which domestic abuse thrives. Therefore, we all need to take responsibility for keeping our communities and Wisconsin residents safe in their homes and relationships.
There are domestic abuse advocacy services available in all 72 counties and 11 tribes in Wisconsin. To learn where the program nearest you is located, please visit endabuse.org/get-help. While the path to preventing domestic violence homicide may not be a simple one, the coalition is committed to addressing anti-violence work with a multifaceted, intersectional approach that centers those most impacted by violence in our state. Together, we can end domestic abuse in Wisconsin.